What's up, y'all? It's Celeste, and I had double incision top surgery with Dr. Garramone on October 10th, so I'm now 2 months post-op. And I'll just go ahead and jump right in, show you my chest, and then I'll come back and tell you a little bit about what's been going on. So I don't look super different from how I looked at the 6-week mark. The incisions really look pretty similar. I think the main difference is the center of the nipples have healed a little bit more. But this area right here, I'm not sure how well it's going to show up on the video, but there's, I've talked about this before, but there's a part of the scar that kind of comes up at an angle here, and there's a decent amount of scar tissue right here. And I actually have a little bit on this side as well, although it's not really visible, but I can feel that there's a little bit more scar tissue and just kind of a little bit more tightness in this center area here. But I'll talk a little bit more about this scar situation in a second when I switch back to my face. This incision on the left side, for whatever reason, has healed a little bit less, I guess, cleanly than this side. The right side is really pretty thin, pretty flat, and just a lot sort of smoother looking than this side. It's more puckered, and there's more scar tissue on this side. It's kind of hard for me to really demonstrate for you, but the scar on this side, like, what scar tissue I feel underneath is pretty much like as wide and not very deep as this scar that you can see. Like, there's not much more to it underneath. Whereas on this side, it's quite a bit wider. Like, I can actually feel it. Like, I feel like I'm kind of on the side of it, like up here. So it's like that much away from where you can see the scar, and then it's quite a bit deeper, like thicker feeling as well. Also on this side, I have a little bit of a dog ear situation. It's pretty mild, but you can kind of see it does come like a little bit to a point right here. And I don't know if that's just the way that the scar is healing, but I also in this area can feel what I believe are some of the absorbable staples that they use to close the incisions. I can't really feel them anywhere else along here. It's more just in this section right here. I can feel them. It just kind of feels like there's little, I don't know, like little hard objects under the skin, which is really kind of weird. But I'm pretty sure that's what those are, and I'll show you what those look like just to give you an idea of what I'm talking about that I'm feeling under there. But again, here is my chest at 2 months post-op. At the 6-week mark, I sent some photos in to Dr. Garramone's office because at my post-op appointment they had requested that I do that. So I did, and actually this past week they were featured on Dr. Garramone's social media, so that was kind of cool. But anyway, when I sent those in, I asked about that spot where the scar tissue is in the middle of my chest, where there's that kind of knot of scar tissue, and wondered if there was anything I should do about it, because Dr. Garramone actually recommends not to massage your scars unless there's a particular reason to do so. So I wanted to know if this qualified as a reason, if this was like, if this could benefit from massaging, or if there was anything else I should do. So I talked to him on the phone about a week and a half ago, and he told me that I should start massaging that area. So I've been doing it since then, and I'm supposed to do that for about a month and then let him know how things are going. I'm not really sure what the plan will be if that doesn't help and I still have the tissue there, what the next step would be. But last week I also went to the dermatologist just for a follow-up because I just go for like acne maintenance basically. And since I was there, I went ahead and had her look at the scars as well, just because like I figured she could actually see them and feel them and everything. It's not like I wanted like a second opinion because I didn't trust what Dr. Garramone said like at all. But I just wanted to see what she thought about it and if there was anything else that she, like any other observations she might have about it. She actually said to do the exact same thing, just to massage that area. I think she said about 3 times a day, and I've been doing it like 2 or 3 times a day. It kind of depends. I can't really wear the scar strips and then also do that like 3 times a day because I don't really want to have to like take the scar strips off and then use a bunch of oil, and then I would have to like wash my chest again because the strips wouldn't stick if I put oil on them. When you massage your scars, it makes this kind of crackling sound, which is kind of weird. And everybody online says that it's the sound of scar tissue breaking up. I don't know if that's true or not, but it's it's a very satisfying sound. It's kind of like when you vacuum, and it's not like I enjoy vacuuming, but the part of vacuuming that I do enjoy is when you can actually hear like all this stuff sucking up into the vacuum, and it's like, you feel like you're accomplishing something because there's this sound of like, I don't know, it's just like crackly sound. That's kind of how this is, and you can also feel it a little bit, so it's like, it's not quite on the level of like bubble wrap, but it's kind of a similar feeling where you can kind of feel stuff like crackling. So it's a little bit addictive actually. And it is kind of uncomfortable too, especially I've been sort of aggressive about it because I really want to get rid of this knot here in the middle, just because it's sort of uncomfortable and I just don't like this feeling of kind of tightness in the middle of my chest. Trying not to overdo it because I don't want to aggravate it so that it just like gets worse, but I am putting a decent amount of pressure on it when I massage, so I don't know, it's a little bit uncomfortable, but it is, like I said, kind of a satisfying feeling. So it's interesting. It's interesting to be doing that, but hopefully, I haven't really noticed much of a difference yet at all, but like I said, I've only been doing it for about a week and a half, so I'm hoping that everything's gonna kind of soften up over the next few weeks, and hopefully I'll be able to just let Dr. Garramone know that it's totally fine now, but we'll see how that goes. I mostly don't really have any pain at all anymore. I do get like aches every once in a while here and there in my chest, and I think it does get a little bit exacerbated when I massage kind of aggressively. But for the most part, I'm not really dealing with too much pain anymore. As far as mobility, I'm not really sure how much more I have really than I did at the 6-week mark. I can't really remember exactly how high I could get my arms then, but I mean, I can get my hands up over my head pretty easily. I can't really get like this part of my arm really any higher than that at this point. But then again, I haven't really been pushing myself to do that because I don't want to stretch anything and I don't want to, like, I don't know, I'm just being kind of cautious about everything. So that's where I am right now. I am able to do pretty much everything in my day-to-day life other than reaching stuff really high. So I do need help getting certain things down off of shelves or like things like that, but mostly I'm able to do stuff. I drove on the highway last week and like, I don't know, I didn't really have any problems with that. So I mostly feel like I'm getting pretty back to normal as far as like movement and stuff I'm able to do. That includes working out, although I am still being very, very cautious about that. Really trying not to push myself too hard. And also I definitely have noticed that I have lost a lot of my muscle and also ability to do stuff since I haven't really been working out too much for the last couple of months or so. So that's kind of frustrating. I actually, like, I've maintained the exact same weight for the last several months, even though I have gotten, like, kind of pudgy around my stomach area, so I feel like that probably means that I've lost a lot of muscle. So that's kind of frustrating, but I'm hoping to work back up. I'm not really, like, a huge fitness person. It is important to me to gain muscle back and to like have strength, and like I want to be sort of toned and stuff, but I'm not like, compared to most people, I probably like am pretty wimpy. I do the exercise bike every time I work out and that's been completely fine. I haven't had any problems with that at all. The strength training kind of stuff I've been doing, like I said, is really basic, but I will put some links in the description to some of the stuff I've been doing because it was actually kind of hard at first for me to find workouts that didn't involve me raising my arms up over my head. Like even a lot of core stuff, like lying on my back on the ground, I still would have to have my arms straight up over my head, and I haven't really gotten to that point yet. So like I said, I'll link some of the ones that I found that don't really require that kind of stuff and that are pretty good for starting back into a workout routine. I know a lot of people like jump right back in and kind of push themselves immediately, but I just really am trying to be careful about things and just kind of take things slow. But I definitely do want to get back to feeling like better. It just makes me feel better when I am working out. Like it makes me physically feel better. So I do want to get back to that. And I'm on my way, but just taking a little while. I've been sleeping pretty normally now. Again, since I don't have full mobility, I'm not in as many different positions as I normally would be. Like normally I would frequently have my arm up over my head or like under the pillow, like straight up above my head or things like that. And I can't really do that. but I am sleeping on my sides pretty easily. I do kind of feel a little bit of pressure when I'm lying like right on the incision on the edge here, but it's not that big of a deal. And I've actually been waking up several times on my stomach, so I seem to be moving into that position in my sleep. So it seems like I'm moving around pretty normally in my sleep and not having really any pain from that or anything, so that's good. The last thing I want to talk about is that I actually got all my medical records from the surgical center, and by the way, you can do that if you live in the US, or I believe if you have your procedure done in the US. I'm not sure how that works if you don't actually live in the US yourself, but under HIPAA, which I want to say is Health Information Portability and Accountability Act, I think. I'll put it up on the screen, whether or not I'm correct on that, but under that, you have a right to all your medical records. So all you really have to do is request them from the physician or facility or whatever healthcare provider you're trying to get your records from. And you might have to fill out like a records release form or something like that. That's what I did with the surgical center, but I was able to get all my records from them. And it was pretty interesting to read. It had like Dr. Garramone's report from the surgery and like the anesthesiologist notes and like all the information about like basically all the details about what the surgery entailed and like all the different medications they used and stuff like that. Which reading the description of the surgery itself was kind of weird, and I don't think I would have wanted to read it before I had the surgery, even though I basically knew like the main things that happened during top surgery. Reading all the like intricate details about like the types of like sutures that they use and like how they like cauterize certain parts of my body and stuff like that, I think would be kind of weird to read before I had it done. I think it would have given me a little bit more anxiety, but now that I've already had it done, I don't really have any anxiety about it anymore, so it was really interesting to me to read. It might still freak some people out, but one thing I thought was interesting is that the surgery itself only took 1 hour and 6 minutes, which is pretty short considering all the stuff that has to be done during surgery, and I thought that was kind of impressive. But I guess Dr. Garramone does so many of these, he can kind of just like knock them out like one after the other. The other thing that was cool was that Dr. Garramone used they, them pronouns for me, like anytime he referred to me in the reports or in his paperwork or anything like that. So I thought that was pretty awesome. Every time I make a video afterward, I end up feeling like I really forgot something really important. So if there was anything I didn't cover here or anything you want me to talk about regarding top surgery or any questions that you have, or it doesn't even have to be about top surgery, it can be about anything. Just let me know if you have any questions or comments or anything. Leave them in the comments below. And let me know if you like this video by giving it a thumbs up and subscribe to see more of my future content. And if you want to be notified as soon as I put up a new video, then hit that bell because that will let you know as soon as something goes up. Thank you so much for watching, and I'll see you guys next time.